Common mental health conditions. Frequently encounter mental health issues. The prevalence of mental health challenges is on the rise in Australia and around the world, with as many as 1 in 4 Australians now receiving a diagnosis related to mental health. Consequently, as a registered nurse, it is imperative to possess a comprehensive understanding of mental health disorders and the necessary skills to care for such patients across all nursing domains. Within the realm of healthcare, mental health presents an area where you will be called upon to provide care to patients who often grapple with mental health issues, sometimes unrelated to the primary cause of their hospitalization. Similarly, for those seeking to broaden their expertise and knowledge in fields like mental health care, there are numerous opportunities available. As nurses, our commitment is to deliver a comprehensive and holistic care in an unbiased and inclusive manner. Mental health conditions encompass a vast and intricate subject matter. Initially, mental illnesses are categorized into 2 main groups: psychotic disorders and non-psychotic disorders. Psychiatric disorders manifest in various forms, each linked to imbalances in neurotransmitters and further subcategorized based on the specific type of psychiatric disorder. Mental disorder can impair an individual's capacity for rational thinking, sound decision-making, appropriate behavior, emotional responses, and effective communication. It's important to distinguish between the actual mental condition and the signs and symptoms it presents. There are instances where patients may contend with multiple disorders simultaneously. The approaches to treatment are as diverse as the range of mental illnesses themselves, typically falling into 2 categories: physical interventions and psychological therapies. Physical treatments encompass various methods, such as medication, brain stimulation techniques involving electricity, magnets, or implants. For instance, electroconvulsive therapy is utilized in cases of severe mania, where electrodes are placed on the temples and an electrical current is administered to the brain. This treatment is typically administered over a series of sessions. On the other hand, psychological therapies emphasize the establishment and maintenance of a therapeutic relationship with the patient, a practice validated by research as highly beneficial. What's crucial for healthcare professionals is to grasp the indicators of mental illness and confront the associated stigma. In order to gain insights into the pathophysiology of individuals with mental health conditions, it is essential to acknowledge the intricate nature of their genetic underpinnings. There is no straightforward genetic marker that directly leads to the development of mood disorders, anxiety, psychosis, addiction, or personality disorders. However, there is a growing understanding of how a combination of biological factors, psychosocial elements such as experiences of grief, loss, and abandonment, and societal factors, including poverty and domestic violence, contribute to the expression of genetic predispositions to psychiatric disorders. Our life experiences significantly impact the functioning of our brain, and although we are aware that the neurons in our brain constantly undergo changes and development, numerous neurochemical factors are at play. It is recognized that the brain is responsible for higher-order functions like reasoning, intelligence, personality, and emotions, and the coordinated interactions between neurotransmitters and receptors are crucial for achieving these higher functions. Research has revealed that many regions of the brain either lack sufficient neurotransmitter receptors or react to specific circumstances, such as sleep deprivation and feelings of sadness. Different mental health conditions can affect various regions of the brain. The realm of substance use is vast and intricate, encompassing various terms to describe it, including addiction, recreational drug use, substance abuse, and misuse. Numerous complexities surround substance use, involving both legal and illicit substances. Legal substances like alcohol, tobacco, and caffeine, along with prescription drugs such as benzodiazepines, opioids, antihistamines, and some asthma medications, are susceptible to misuse. Illicit drugs can be categorized based on their effects, such as inhibitors, stimulants, and hallucinogens. Sedatives like heroin and other opioids contrast with stimulants like amphetamine, cocaine, and ecstasy, while LSD falls into the hallucinogenic category. Some substances, like marijuana, can fit into multiple of these groups. Alcohol abuse can lead to severe problems and potentially fatal outcomes with excessive consumption. The physiological underpinnings of drug use are closely tied to the mesolipid dopamine pathway, culminating in a sense of reward. Initially involving signal-crucial behaviors for Asian humans, such as seeking and consuming food, as well as engaging in reproductive activities vital for species survival. These activities trigger dopamine release, resulting in a natural sense of pleasure. Over time, humans discovered substances like alcohol and opioids that artificially induce dopamine release. Exposure to such drugs can lead individuals with addiction to prioritize drug use above all else, driven by the belief that it is essential for their survival. Effectively communicating with individuals involved in substance abuse necessitates the application of therapeutic communication and a person-centered care approach. This method enables a thorough and precise assessment to determine the most appropriate service for the patient, particularly in the context of multidisciplinary teams and diverse healthcare institutions. During the acute phase of intervention, it becomes essential to evaluate and address conditions such as delirium and anxiety when necessary. The patient demographic you will encounter encompasses a wide spectrum, including incarcerated individuals and their correctional officers. Individuals brought by the law enforcement due to arrest or protective measures, and individuals referred for evaluation by community mental health teams. Furthermore, concerned family members may bring in a loved one exhibiting concerning behavioral changes. In each of these scenarios, the potential for emergency situations exists. As a healthcare professional, it remains crucial to consistently prioritize your personal safety. This consideration underscores the association between mental illness and the possibility of violent behavior. Providing emergency medical attention to individuals using illegal substances. Mental well-being across the lifespan, addressing the needs of patients undergoing withdrawal from substance abuse. Assisting patients experiencing substance abuse withdrawal can pose significant challenges. It's important to have knowledge of various drug categories, including central nervous system depressants, stimulants, hallucinogens, and more. Two critical aspects of drug misuse involve the risk of overdose and the difficulties associated with withdrawal. The neurobiological components of withdrawal are intricate and involve various facets. The withdrawal process is primarily regulated by the amygdala, a brain region responsible for memory and emotions. It sends signals to other areas by boosting dopamine release, requiring adaptation to maintain balance. Unchecked alcohol withdrawal possesses a significant risk as the brain and central nervous system strive to recover from prolonged alcohol suppression, potentially resulting in seizures, which can be life-threatening. At times, patients may voluntarily seek admission to a facility with the explicit goal of abstaining from substance abuse, while others may be admitted unexpectedly. In either case, it is crucial to manage their situation carefully to minimize potential harmful side effects. Numerous medications are employed to aid in the withdrawal process. In our capacity as nurses, we can introduce a monitoring tool designed to assess withdrawal symptoms, known as the alcohol withdrawal scale. It is important to know that this scale doesn't diagnose withdrawal. Rather, it monitors the clinical indicators and symptoms in individuals at risk of alcohol withdrawal. As nurses overseeing medical admissions, we have the ability to implement the alcohol withdrawal scale if we believe a patient may require support during their hospitalization. About smoking, as nurses, it's our responsibility to provide supportive therapy to patients who smoke. Managing any drug dependence requires a proactive approach, and we, as nurses, can be the first to identify these concerns in our patients. It is essential to take proactive steps to support our patients rather than reacting to a potential need for increased care, such as having to explain to a patient under cardiac monitoring that they cannot go outside for a cigarette. Mental disorders in pediatric patients. All pharmacological treatments should be employed when necessary, rather than as a substitute for other therapies. They should be tailored to the specific individual, and patients should be informed about the expected duration, response process, and any potential adverse effects. It is advisable to recommend the use of the simplest and lowest effective dose of treatment, and follow-up compliance is of paramount importance. The mental health challenges of children and young people are a major issue. It is vital to pay close attention to every patient you encounter. Be alert to any obvious factors that may come to your attention, as a direct conversation may be all that is needed to provide additional support to your patient. Look at every interaction as an opportunity to create a positive impact. Maternal health and mental illness. When dealing with female patients, it's essential to take into account with prenatal and postnatal concerns, as well as mental health issues specific to women, including hormone imbalances, menstrual cycles, pregnancy, breastfeeding, and menopause-related matters. The mental health condition of this demographic can vary significantly at various stages of their lives. Understanding the impact of different life stages on individuals is crucial. Equally important is the ability to provide patients with clear and effective guidance. If a mother's mental health condition is as severe as the medication she could use during pregnancy or breastfeeding, it is advisable to avoid medication during pregnancy whenever possible, and if necessary, use the safest medication at the lowest effective dose. Depression can occur during pregnancy and postpartum, and suicide is the leading cause of maternal mortality in Australia. The well-being of both the mother and the infant is paramount. Mild to moderate depression should be managed through psychological therapy. While for more severe cases of depression, SSRIs, excluding parasiting, are generally considered the safest option during pregnancy. Current experience with SSRIs suggests that infants exposed during pregnancy and breastfeeding typically have normal cognitive development but may have an increased risk of behavioral issues.